Hey Savvy social workers, let's get into some general practice questions. A 15-year-old girl has been sent home from school on 3 occasions for drinking alcohol at school. Each time, the mother becomes angry and threatens to punish the girl, but is convinced by the father to give her another chance. Which of the following best characterizes the father's behavior in this situation? Is it triangulation, enabling, advocating, or manipulating? Okay, so the answer for this one is going to be enabling. Enabling is the behavior of protecting others from experiencing the full impact and consequences of their behavior. I would advise that you take some time to maybe pause and look up the definitions of these other words as well. But for this question, the answer is enabling. A social worker at a community clinic is working with clients who have recently been affected by a natural disaster. In on-site basic crisis intervention, what should the social worker assess first? So we're in a community clinic and we are working with clients who have recently been affected by a natural disaster. So the first thing we will want to assess for, is it the client's immediate need for physical safety, food, and clothing? Yes, we're going to pause that one. Is it the client's response to the trauma? Is that going to be the first thing? Possibly, so let's pause that. C, the client's future mental health risk. We can go ahead and eliminate that because we know that that's not going to be the first thing we assess for. And D, the client's need for various tangible services such as transportation and alternate housing. The tangible services we know can come later down the line, so we will eliminate that. So now, in assessing first these clients who have just been affected by a natural disaster, what is going to be the most important, because this is the first question? The client's immediate needs for physical safety, food, and clothing, or the client's response to the trauma? Okay, well, first let's take care of their physiological needs, and then we can take care of their mental health needs. The physiological needs are the most basics of Maslow's hierarchy. These are the essentials people need for physical survival. Examples include air, food, drink, shelter, clothing, warmth, sleep, and health. If you fail to meet these needs, the body cannot properly function. So we want to take care of this before we deal with the mental health issues of the trauma. A man is referred by his primary care provider and presents with a diagnosis of hypochondriasis. To successfully begin treatment with this client, what should the social worker do first? Okay, so we know that this man was referred by his primary care provider and he has this diagnosis, which I'm not going to continue to butcher the name, but y'all see it. To successfully begin treatment, so we're talking about beginning treatment, what is going to be the most important thing? Is it going to be to conduct a biopsychosocial assessment to learn about the client's history? Possibly, so we'll pause it. Is it going to be to establish trust and concern for the patient's problems? That's another possibility, so we'll pause that. Educate the client about the link between stress and physical health. Well, not in the beginning. We're not really going to worry about educating just yet, so we'll eliminate that. And D, discuss his treatment plan. Again, we are not there yet in the helping process. This is a referral, so that tells me we are in the beginning, so we want to focus on what we do in the beginning phase of the helping process. So we know that hypochondriacs or usually when the individual or the individuals that have like a health anxiety, it's another word for health anxiety, where they worry excessively that they may become seriously ill, even if they have no physical symptoms. So we know that that's what that is. So in successfully beginning to treat this client, what are we going to do first? Are we going to conduct the biopsychosocial assessment to learn about the client's history, or are we going to establish trust and concern for the patient's problems? Well, this is a key question to understanding the social work helping process, which we know at the top of that is the E, which represents engage. And so we want to first start building rapport and building that trust, showing that concern for the client before we start getting all in their business. So the assessment comes after, you know, the engagement. The first thing we want to do is engage with our clients. And a lot of times it also begins to occur simultaneously. But we first start off with engaging that client and building rapport. So that would make B the answer due to the helping process. Okay. The first step in the helping process, again, is to engage the client, to build that trust and develop that therapeutic rapport. After which the social worker can focus on getting the client's historical information. A new social worker is working with an older female client who is the CEO of a successful company. The social worker acknowledges that she struggles with women in authority positions stemming from her poor relationship with her mother. In working with this client, the social worker is likely to experience. Okay, so first off, let's pay attention that she is a new social worker. She's working with an older female client who is the CEO of a successful client. A successful company. I'm stumbling all over my words today. All right. The social worker acknowledges that she struggles with women in authority positions stemming from her poor relationship with her mother. That is going to be our priority problem. So she's a new social worker and she gets this client, this older female client who is a CEO of a successful company. The problem is that she struggles with women in authority positions, okay, because she had a negative experience with her own mother. So the question is asking us, in working with this client, to pay attention to this snippet, because that means your answer is going to be based off of this snippet in addressing the priority problem. So in working with this client, the social worker is likely to experience emotional attachment when working with this client. Remember, she struggles with women in authority. Emotional attachment. Why would she become attached to this woman when she struggles with women in authority? So we can eliminate that one. Countertransference. So we know that countertransference is when the therapist exhibits certain feelings toward the client. So this is a possibility. Transference is just the opposite, when the client is exhibiting certain feelings towards the therapist, which is not taking place here. So we can eliminate that. And then the last one is resistance. Is this a form of resistance? Will she experience resistance? Is she likely to experience resistance to this client because she struggles with women in authority? That is possible, but because it lets us know that this is stemming from her poor relationship with her mother, makes it more personal. So that would make it countertransference instead of resistance. Okay, so remember countertransference is like redirection of the therapist's feelings toward the client, or you can think of it as the therapist's emotional entanglement with the client. And then transference is the opposite, where it's the client's emotional entanglement with the therapist or towards the therapist. So this is a recall question, and I wanted to present this question because someone recently told me that they saw it on the exam. So you have to be able to distinguish between these definitions. So it would be a good idea to pause the video and make sure that you are getting a good understanding of the differences between these definitions. So the belief that certain wishes can be fulfilled by the power of one's thoughts alone is. So which one of these definitions define when a person believes that certain wishes can be fulfilled just by him thinking it? So that means just thinking something into fruition. They believe that if I think it, it's going to happen, or I can think it and I can control this matter. Is that depersonalization? Okay, well, for teaching purposes, we're going to go through this one just a little bit differently because I want you to know exactly what these words mean. So depersonalization involves a persistent or recurring feeling of being detached from one's body or mental processes. Okay, so it's like an outsider observing one's life, so they feel outside of their body when they're depersonalized. So think about de-person, so you're detaching yourself from who you are as a person. Okay, so does that sound like certain wishes can be fulfilled through the power of one's thoughts? No, it doesn't. That sounds like something way more extreme, so we will eliminate that. But just remember, this is a term to know that when you depersonalize, that means you detach yourself from you as a person, and it's like you're outside yourself. And then there's usually another term that's also closely associated with it, is derealization, which is being detached. Again, that D means detached from your surroundings. So it's like being detached from reality. So depersonalization is being detached from yourself, so being outside of your body, and derealization is being just detached from reality, period. Okay, so the next definition, magical thinking. Is this when certain wishes can be fulfilled by the power of one's thoughts alone? This does sound similar to magical thinking, because magical thinking is when a person believes that their specific words or their thoughts or how they're feeling can influence things that are happening in the external world. So because I think it, because I speak it, because I feel it, this influences what's going on around me. This can influence that. So this is magical thinking. This is why this is common a lot of time in young children. So we're going to pause that one. Thought broadcasting. Okay. So this is also a psychotic symptom in which a client has the experience that their thoughts are being broadcast out loud. So just think about what the word says, thought broadcasting. Their thoughts are being broadcasted aloud so that people around them can hear their thoughts. So they think that people can hear what they're thinking. This is most common in people with bipolar disorder, schizophrenia, schizoaffective disorder, a lot of, those delusions where they're thinking that people can hear their thoughts. That is thought broadcasting. Does that relate to the definition that we have up here? Certain wishes can be fulfilled by the power of one's thoughts. Even though this is talking about the thoughts, this is not saying that or alluding to the thoughts being heard out loud by other people. So we will eliminate that. Now, the last one is looseness of association. And this is simply kind of what it sounds like as well. This is when there's no connection between the words that the client or the person is saying. Like they're just jumping, they're in one sentence, but they're jumping from topic to topic to topic. Their words are not connecting or making sense. It's just a whole bunch of loose associations. Nothing is associating, nothing is making sense. Nothing they're saying is making sense. They're just like mumble jumbling. That is what we call loose associations. So that again has nothing to do with what our priority focus is. So that leaves us with the closest and most accurate definition of magical thinking, again, which is when a person believes that their specific words, thoughts, emotions, or rituals can influence the external world, okay, around them. A social worker is assessing an individual who is suffering from major depressive disorder. Which of the following would the social worker not expect the client to exhibit? So my people who work with me know that when I have these questions that ask me which one is not, or all of the above except, then what I do is I automatically go and I flip that out. I take the word not and I go and I scratch out all the ones that are, and whatever is left standing will give me what is not, or what the exception is. So in this case, we're assessing an individual who's suffering from major depression. So that's going to be our initial situation, or what I like to refer to as a presenting problem. And so that's all they give us. So that's going to both serve as the presenting and the priority problem. Okay. So the question is asking, which of the following would the social worker not expect the client to exhibit? So what we're going to do is, let's see, for a client that is suffering from major depressive disorder, what would we expect him to exhibit? Would we expect them to exhibit an unkempt appearance? Yes, we would. So we will eliminate that, because remember, we're not worried about the knot right now. Would we expect the client to exhibit underproductive speech? Yes, when someone's depressed, their speech is not as it is usually. So we can eliminate that. Would we expect the client to exhibit constricted affect when they're suffering from major depressive disorder? Absolutely. That's one of the hallmark signs. Okay, and last but not least, would we expect the client to exhibit super focused thought process when they're suffering from major depressive disorder? Well, we know when someone is depressed, they find it very hard to focus. So this one is not something that we would expect, which is what the question is asking us. Which of the following would the social worker not expect? This is the last man standing, and this is the process of which I get to these types of answers for anybody who, struggles with flipping it, or being confused about answering the not questions. That's just how you flip it. Just take that word not out, answer all the ones that are, whatever left is standing is not. The same rule applies to when they say all of the following except. Just do all of the following and scratch out all of the following, and whichever one is left standing is going to be the exception. So the answer for this one is D, because we know the thought processes of a person with major depressive disorder would most likely be distracted and disorganized rather than being super focused. A social worker is meeting with a 40-year-old male client who explains that he is seeking care because he suffers from panic attacks. He notes that he gets chills, nausea, dizziness, and experiences fear about once a day. What should the social worker do first? All right. So again, our presenting problem is why he's there, the initial situation of what brought him in. He's seeking care because he suffers from panic attacks. That's the main deal. The priority issue is that he's telling me that he's experiencing all of this at least once a day. That's going to be our priority focus. What is going to be the most important thing we do about this client who's seeking care due to suffering from panic attacks that is experiencing all of these symptoms? Okay, so remember, when we have a first question, we're looking for the most important thing. Are we going to first teach him relaxation techniques? Okay, well, we are not going to teach him right off the bat. We're not going to start teaching him relaxation techniques because, first of all, we're just meeting with him. So again, whenever it says is meeting, that lets me know that we are in the beginning phase of the helping process. So we're not teaching yet. We're not in that phase yet. B, set goals for the reduction of anxiety. Again, we are just in the beginning. We are just meeting with this client who is, telling us why he's seeking care. So we're in the beginning phase of the helping process. We're not in the planning phase yet. So we can eliminate that. This is how using the helping process can help you not only pick your answer, but validate your answer as well. Because you know that if you are in the beginning phase of the helping process, then you're primarily engaging and or assessing the client. You're not yet teaching or planning or doing any of those things. And let me be clear. This is how I denoted that we were in the beginning, because anytime I have found that these exam questions say a social worker is meeting, that 9.9 times out of 10 means that you're in the beginning phase. Now, if it says is working with, that means you've already started working with them. So that tells me that we're most likely in the middle stage. If it says is seeing a client, that sometimes can be in the middle, but that normally kind of goes to the side of already have you're not in the beginning, you're pretty much in the middle if it says is seeing the client, because it's like you're already working with them. So if it says is meeting, that specifically lets me know we're in the beginning. So would we arrange a doctor's appointment for this client? Now he's telling us that he gets chills, nausea, and all these other things. So we can pause that because that may be something, since that is our priority focus. And D, assess the client's current situation. Would that be the most important thing? All right, so we're just meeting with this client and he's telling us that he needs help because he has panic attacks, and he's talking about, the physical symptoms that he has. Well, the first thing we want to do when we're meeting a client is build rapport and assess. So before we start implementing anything, arranging for a doctor's visit or whatever the case may be, let's assess his current situation and see what's going on. Maybe there may be something else that we can do to help better understand or gain insight to what is causing the panic attacks, what else may be causing these symptoms that he's having before we arrange for a doctor appointment. So let's assess the situation first, and then we can move forward with arranging a doctor's appointment. So meet the client where he is, assess him first, and then arrange for a doctor's appointment. Now, if the client came in and he currently had those symptoms, yes, we need to get him to a doctor. That would be the difference. If he came in and he was like, having the chills, and he was nauseous, and he was dizzy, and, feeling really anxious all in that moment, at the moment, because remember, we're in the moment, we want to get him some physical help. However, that is not what this stem is saying here. It is just saying he notes that this what happens. It's not saying that this is currently happening. That is the difference here. Please make a note of that. Now, this is a recall question that I thought would be important to present as well, because we have to know these type of things for the exam. So which ethical standard of social work is best represented by the ability to keep personal needs and feelings separate from professional relationships? Okay, so we're looking for the ability to keep personal needs separate and feelings separate from professional relationships. Is that professional discretion? Maybe. Pause. Is it responsibility to the profession? No, that's not really a responsibility to the profession. And just remember that they're asking about the ethical standards of social work. So think about our ethical standards for this one, okay? All right. Is it professional boundaries? That definitely sounds like that could be plausible as well, because the ability to keep our personal needs and feelings separate, that kind of lets me know that we need to exercise some type of discretion or some type of boundary, okay? And responsibility to colleagues. No, this is not a responsibility to our profession or to our colleagues, okay? So going back to the two that we have, is it professional discretion or is it professional boundaries when we are trying to keep our personal needs and feelings separate from our professional relationships? Is that discretion or is that boundaries? And I'm sorry about the phones going off in the background, y'all. But that is going to be a boundary when you are trying to keep your needs separate from your profession. That's setting a boundary, okay? So now, of course, we use discretion when we're setting boundaries, but overall, the ethical standard that they're asking about is going to be professional boundaries. And this is more so a recall question that I felt like would be important for you all to be able to distinguish between. So know all in all, know your ethical standards. And lastly, a social worker is receiving a client with long-standing depression. It becomes clear to the social worker that the client has racist beliefs. The social worker should. So I made a quick edit. Instead of a social worker is receiving a client, we're just going to say a social worker is seeing a client, because I'm sure that that's what it was supposed to say. So that is going to be our priority problem. It becomes clear to the social worker that the client has racist beliefs. That's the priority. The social worker should. So that lets me know this is ethics. So this question is asking me, what is the most ethical thing that I should do about the priority problem, which is recognizing that my client has racist beliefs, whether it be towards me or other people. I recognize that my client has racist beliefs. And one of the other things I'm going to interject here is that what really helps me to understand and answer these questions literally is to interject myself live into them. So when I'm answering these questions, instead of just saying the social worker, thinking of it from the social worker as being a third person or a third party, I interject myself in there personally, and I'm like, okay, I am the social worker. So it had just become clear to me that my client has racist beliefs. What should I do? So I make it personal like that, and it just helps me to see the situation more clearly, which helps me to better define and pick an answer. So in this case, what would we do? Would we respectfully confront the client's prejudice beliefs? Well, we definitely don't want to be out here confronting our clients' personal values and beliefs systems, so that is not going to be the most ethical thing to do. B, educate the client about the negative effects of racism. That is something that we could do. Is that the most ethical thing? It's not, because this client has a right to feel and believe how he wants to. So us trying to educate him on the negative effects of it is just not relevant here in this matter. Okay, so we're eliminating that. C, refer the client to another therapist who is more aligned with the client's beliefs. Is that the most ethical thing to do as a social worker? I don't think so. And lastly, it is respect the client's beliefs and focus on the presenting problem. The client comes to us for whatever his priority or his presenting problem is, and that is our task, to intervene with his problem and help to address that. Respecting the beliefs and values of our clients is an important part of establishing an effective relationship between us and our clients. So failure to take his beliefs seriously is like undermining him or undermining his beliefs, which will affect his ability to trust me and build rapport with me as a therapist. So I can still work with him and he have his beliefs about certain things, I have mine, and they don't have to conflict. So if it does seemingly become a conflict, then we will go, into consultation and see what needs to be done from that point. However, that is looking beyond the situation that's at hand. All this situation here is saying is that it becomes clear to the social worker that he has racist beliefs. So, okay, we're going to respect his beliefs and deal with his problem, because that's what he's here for. Okay, so let's just make that clear. This is an ethical situation. Just know that we can't just toss off our clients because they don't have the same beliefs as us, or if our clients believe in abortion and we don't, or if our client believes in gay marriage and we don't, or whatever the situation is. We can't just be like, okay, well then get somebody else to do it. We'll get another client, another therapist who thinks like you. That is not ethical. It is not professional for us. So we have to respect the client's right to their own beliefs, which goes up under the umbrella of respecting their rights to self-determination. Again, I hope this was helpful. I just wanted to bring primarily a lot of these questions were primarily from the content base. I want to give you some more content questions because I know I give you a lot of strategy questions, even though there was some included in this video. But y'all make sure that y'all are getting in depth with this content, because a lot of people are struggling in the content areas of the exam. Now we're getting the strategy down pat. We're understanding how to break down these questions, these first and next questions, but we are kind of fading away on the content area because there's so much content to study. So just make sure when you are studying content, my best advice for you would be to study the content areas, to reason with them, give yourself examples, place yourself live in the situation like I expressed earlier, to make it more realistic to you. And so it would actually help the content to actually feel more realistic to you. So again, I hope this was helpful for you. Thank you all for continuing to support Savvy Social Worker Exam Prep. I am beyond grateful for the support. I love the comments, so y'all keep them coming. Please like this video, subscribe to this channel if you have not already, and share this with all the social workers that you feel like could utilize this free content. Okay, so again, thank you so much, and let's continue to get those passes the Savvy way.